What's up, guys? Today is an upper pull, lower push. It's a classic day. We're doing elimination style, AABB times 2 in each station, straight through and no time for finishers. All right, so looking at the exercise, looking at the workout today, one thing to point out, the TRX station, they're doing TRX face pulls or high rows, and so that'll be paired with a banded quick feet, and they can keep the bands on the entire time, and then they'll just kind of waddle over to the TRX, do their face pulls, and then kind of waddle back, get some space, and switch to do those banded quick feet. All right, so the band stays on there. We have two different lunges or split squats today, the front foot elevated split squat, and then an overhead reverse lunge as well. And so I would say for high risk, start at the overhead reverse lunge, just because it's a lunge but also an overhead, which we know can be a little problematic for anybody with back or shoulder or anything like that. All right, so start there, high risk exercise for sure. All right, for my pro coaching tip today, something I wanted to talk about was something we want to coach our clients to do is essentially to recognize and feel what we talked about last time, feel what it feels like to do it right, but then they should start to recognize what it feels like when it starts to go wrong so they can start to self-correct. Okay, and oftentimes what clients need to know, it's okay if they're really pushing themselves, especially on 38 seconds, which is a little bit on the longer side. It's okay if they either need to A, drop down a lighter weight, or B, actually slow down as they get towards the end. Yes, we want to push them and bring up the energy and everything like that. That's not what I'm talking about. I'm talking about, say you're doing face pulls and you're getting so tired and fatigued that all of a sudden, you start arching your back and swinging and pulling and your hips are dipping. You're just trying to muscle yourself up, right? What would actually be way more effective, and what that client needs to know, is if they just take a little step back, so it's a little easier, they can get perfect form and get those last couple of reps in. All right, same thing on an overhead reverse lunge, because that's our high risk today. If I'm holding a dumbbell up, I'm doing my lunges, I'm doing my set, last few seconds, I'm starting to arch my back, the shoulders dying, my elbow starts bending, and I'm doing it with terrible form now. It would actually be better if I just brought the dumbbell down, maybe held it at my chest, and did 1 or 2 more reps at the end, okay? And so the point of all this is to say, get them to work smart, get them to feel what it feels like to do it right, to the point where they start to feel what it feels like when it's going wrong and how they can actually correct it, but then get the most out of their workout. So I know that was a lot kind of all over the place, but hopefully it's helpful as you continue to coach your clients so they can also coach themselves. So at the end of the day, they are their own best coach. That's what I got, friends. See ya.